Assalamu alaikum. So, my name is Mohammed. You're probably wondering why I'm here talking about public policy, considering that I did genetics. Until recently, I wasn't actually very strongly involved in public policy. But I got involved with an organization called Polygeia, which is only an organization at 3 years old. And this organization has now turned into one of the largest student-run think tanks in the UK, based around global health policy. It started off in Cambridge, and now it's off in London and Oxford, and it's gone into, now we've spread over into New York. And the point of this organization is to encourage students from across these universities and cities to do meaningful public health and global health research, and take that research and put it in meaningful outputs. For instance, presenting it to Parliament, presenting it into organizations, NGOs, charities. And there's some really good success stories that we've had, even though we're such a young organization. So we found that over the 3 years, so what I'm going to be talking about is the ways that you can increase youth involvement in public health, but also the need for diversification amongst the youth, in that you should spread out from the original subject that you've been doing. So you're probably wondering why are students important? So throughout the whole day, we've been talking about the importance of the youth involvement in public health and global health. The reason is, the reason we see it as well, and how we market ourselves in Polygeia, is there are four main things that we can provide as students and as youth. Number one, we have a lot more time on our hands. Although we are doing our degrees, we have our weekends, we have time, and often students are very keen to get things in their CV, so they're willing to sacrifice time for these things. Another thing is academia. So we have students from a variety of different backgrounds. It's not just medics. You have people that are economists, geographers. And the good thing about university in general is that university is like a hub where all these ideas and free thinking comes together. And you don't get that free thinking once you leave university. As soon as you leave university, you become specialized in a specific subject, and you never diversify from that subject. But the importance of getting it early in university is that you've not yet specialized. You have all this lateral thinking, this broad thinking, and you need to keep hold of that. So that brings over to the ideas, which is the third point, the wealth of ideas, wealth of innovation. And the last one is papers. So a lot of the students that we get involved in are master students, PhD students, as well as undergrads. And these are students that have published in peer-reviewed papers multiple times. Some of these have already worked with NGOs and organizations. Many of these have presented white papers, presented peer-reviewed papers, so they have experience. And we provide that experience. And we shouldn't overlook students as being, naive, unexperienced people. In many cases, yes, we are, and we need a lot more growth. But there is a substance there that we can build upon. So we found there were four things that you need to get students involved with global health policy. The first one is organization. So organization on two sides. The first is having an organization, such as the organization that organized this lovely conference. It's an outlook. It's sort of a mechanism, a platform which students can effectively research and output and feel that they're part of something, they're part of an organization. And that's why you need an organization to be encouraging students to get involved. Another thing was branding. So, for instance, this is the organization that we have been running. Another thing is branding. Now, branding is often overlooked. Why is branding important? Branding makes your organization seem professional. And being professional is good for two things. Number one, it's good because it encourages students to join. Students aren't going to join an organization or any sort of think tank or anything unless they feel that their efforts will be good for their CV, if you're going to be cynical about it, but also good in terms of they feel like their work is useful, their work will be put out there and be meaningful in the real world. There's no point researching things that will just go into your pockets or onto a piece of paper. You want it to be meaningful and useful for something. It's also useful for getting commissioners. So a lot of the commissioners, external commissioners and MPs that we get to give us papers, they come to us because they see that we're a professional organization. We are very organized and we can get things done. And half of that is done through branding. Next one is support. So these are just some of the organizations that have supported us over the years. Couldn't read all of them because too many. The whole point of support is, number one, they give you projects. How is a student supposed to know what's important to learn? What's important to research? How are we going to know what's needed to know in the real world? It's through these organizations. These organizations, they come to students, they tell us, this is a problem that we have in the real world. Fix it. Come up with a solution for it. Otherwise, we wouldn't know where to work. And also, these support organizations are very good because they provide us free training, they're free sessions, they provide us office space. And that's why you need these organizations. Otherwise, you're just flying blind and you've got no support in your backing. And lastly is variety and fun. Now, this is probably the most important one. Students will only do stuff if they get enjoyment out of it. If they don't get enjoyment out of it, they're not going to do it. So you need to get socials. You need to, when you have a training event, you go out for dinner, you go out for lunch, you encourage them to be part of a community. If you're not part of a community, if you don't feel part of something that they enjoy, they're just going to leave it after a year. So to retain students, you need variety and enjoyment. And these pictures you're probably wondering at the bottom, these were just the placeholders for the themes that we had in our conference last year. And the importance of this is that we showed there's a variety of different themes that we're doing because students are interested in different things. Some students are interested in female health, some interested in tropical health. And so you need to provide them the variety and the options that they can choose from. Right, so the point of this next slide is to show that students are keen. They are actually keen to get involved with global health. And also that meaningful work can be done. So these are just some of the things that we've done over the last, actually this is all this stuff is from the last 2 years, not even the last 3 years. So for instance, this was the paper that we presented in the House of Lords. This is the one for Action Against Hunger, which is a charity. This is one for the Global Health Exchange, which is a think tank that's owned by the NHS, works with the NHS. And then these are just some of the pictures from the conference that we were doing last November. And you can see that a lot of students, these are only part of the students that came, you can see that students are keen to get involved. And this is a message to whoever's watching and who wants to get involved with students. The students are there, they want to get involved. What they want is they want people to guide them and take them along the journey. So the next point is the point of diversification. Now I mentioned before that it's very important that you get students early on before they become specialized in their field. Because although it's very good to be specialized, you also need to have lateral thinking. So you need to at least expose the students to other modes of thinking so that they can appreciate it when they do research in the future. And we do this partly through training, but also it's the fact that at university you've got so many people from different subjects. When you come to a project, you recruit people from many different subjects and they all sort of contribute to this multifaceted thing that is public health. Public health is not just a medical thing, it's not just a social thing, it's not just an anthropological thing. It's all these things put together, and you need people from different sides to be able to come together and show the different the different aspects of a single topic. So, medics. I'm very critical of medics. I'm a medic, but I'm very critical of medics in that we are very narrow-minded. We believe there's only one way to do things, and we often ignore the other side, the social side, the anthropological side, and the cultural side, the religious side. That's something that you need to do with various perspectives. Decentralization and competition is also another important thing. For instance, competition, a lot of policy is not dictated by medics, it's not dictated by academics. Policy nowadays is dictated by organizations and companies and corporations. These corporations, such as the food, drink, alcohol, tobacco industries, these are powerful organizations, powerful industries. And the reason that they can push policy is because they have this huge wealth behind them, this huge expertise behind them, that they can influence politicians to introduce policy that benefits them. So how do we compete with that? An academic will come forward with all this evidence, all this intricate knowledge about why such and such a thing is important, but politicians don't really care. Politicians, they want simple, actionable action points, and they want it to be sold to them in a way that they can digest and put into meaningful practice. And the only way you're going to get this in medics and other professionals, other healthcare professionals, is to train them and expose them from an early stage to other ways in putting your point forward. It's not just sort of getting a paper, a peer-reviewed paper and saying, see, look, smoking is bad, we need to stop smoking. It's about showing the social impact, the economic impact, showing all these multifaceted benefits that we often overlook. This last point, I don't want to talk too much about it because of time restraints, but this is an organization called Health Leads. They're an organization based in the States. I think they're also working in like Boston and a few other cities. The point of this organization, the idea behind it is that doctors shouldn't just be prescribing medications. The idea was that they found that when a person comes to the hospital or to the clinic, they often, have malnutrition, they have poor social backgrounds, and the doctors can't deal with that. The doctors aren't just going to prescribe, often the patients will come with an ear infection, so they'll just prescribe an antibiotic, but there's all these other things going on behind them. So Health Leads said that a doctor should instead of just prescribing normal medication, they should prescribe, for instance, heating. They should prescribe food. So what they would do is on the actual prescription papers, they would write food, like certain types of food. They would prescribe heating. And then they would send it to this organization who would then use social care to organize these provisions. And it just shows the importance of interaction with loads of other organizations and other the sectors of healthcare. Now, how do you get diversification among students? And this is the crux of it, but it's a very simple thing. So, firstly, inspire. This is what we try to do, and this is what we want all the you lovely academics and professors who have a lot of weight in the field to do, because it's you guys that are going to be doing it. You have to inspire students and the youth that what they're doing is useful. They can make a difference. Even though the difference is little compared to what the WHO does, they need the inspiration that their opinion matters. And you need to provide leaders to them, show them that, we need people to push the field forward. Here are people that have done it. Here are examples of achievable ways it has been done. It's not out of the question. You need to provide support, which is very simple, It's just simply maybe either like telling them which ways to go, giving them contact details, or just giving them moral support. And then the last one is networking. Networking is a very key one. That's why we're here today. And it's also something that we encourage in other organizations and other societies, and it's very useful in university as well. Networking means that you appreciate other opinions. You appreciate other sides of this multifaceted, multi-sided thing that is public health. The economic side. You've got the social side, the medical side, the anthropological side, like I've just been mentioning throughout this whole project, this whole presentation. So, yeah, thank you very much.
Thank you.